Did you know that April is Testicular Cancer Awareness Month? Let's have a real talk about testicular cancer, or simply, cancer of the testes. Kadalasan, iniisip natin na pangmatanda ang cancer, pero hindi ito palaging totoo. Did you know that this is most common between the ages 15 to 55, and it actually peaks at age 25 to 35? Yes, mga young adults ang madalas tamaan nito. And 95% of testicular tumors are germ cell tumors. Sino ba ang may higher risk na magkaroon nito? Let's break down the risk factors. Kasama rito ang pagiging white race at pagkakaroon ng germ cell neoplasia in situ. Isa sa malaking factors ay ang cryptorchidism o yung tinatawag nating undescended testes. Males with cryptorchidism or undescended testes are 4 to 6 times more likely to be diagnosed with testes cancer in the affected gonad. Pero good news, the relative risk falls to 2 to 3 times if orchidopexy is performed before puberty. Importante din ang family history of testicular cancer. Males with a first-degree relative with testes cancer have a substantially increased risk. For example, an individual's relative risk is 8 to 12 kung ang affected relative ay brother, compared to 2 to 4 in those with an affected father. At kung may personal history of testicular cancer ka na, take extra care. Males with a history of testes cancer are at a 12-fold increased risk of developing a germ cell tumor in the contralateral testes, or yung kabilang testicle. So, ano ba ang mga dapat bantayan? Paano mo malalaman? The most common presentation of testes cancer is a painless testicular mass, nodule, enlargement, or induration. Yes, madalas walang sakit. Pero patients may also complain of vague scrotal discomfort or heaviness. Kung mabilis lumaki ang bukol, pain may be present from rapid expansion. In some cases, patients may present with enlarged lymph nodes of the lower neck or upper chest, a retroperitoneal mass, gynecomastia, venous thrombosis, or pulmonary embolism. Ngayon, the big question. What to do when I think I have testicular cancer? Simple lang ang sagot, go to a doctor. Huwag mahiya at huwag ipagpaliban. Pagpunta mo sa doktor, a transscrotal ultrasound with Doppler should be performed, along with laboratories to check tumor markers. If ultrasound findings show a mass suspicious for malignancy, then a radical inguinal orchiectomy is generally performed to make a diagnosis. It is important to note that this surgery, radical orchiectomy, establishes the diagnosis. In select patients, like those with synchronous bilateral tumors, a solitary testicle, or a functionally solitary testicle, testis-sparing surgery, like partial orchiectomy, may be considered. Marami ang nagtatanong, do I need chemotherapy after surgery? It depends. Testicular tumors can be classified into two big categories, seminoma and non-seminoma. After the surgery, we determine the stage of the cancer based on tumor markers and imaging findings. Kaya patients should always go back to their doctor for follow-up and discussions for steps moving forward. Iba-ibang treatment per person. There will be some who will undergo surveillance and have regular checkups. There will be others who will undergo adjuvant chemotherapy, radiotherapy, or both. In some cases, especially those with metastasis to these lymph nodes, a follow-up surgery called retroperitoneal lymph node dissection will be required. And here's a major concern for many young men. Can I still become a father after surgery? The short answer is yes. Although approximately 2/3 of males with germ cell tumors have diminished fertility, it is an uncommon initial presentation. The great news is, up to 81% of men still father children after radical orchiectomy. If you need chemotherapy and you had normal semen parameters at diagnosis, 50% will return to these levels in 2 years, and 80% in 5 years. After radiation therapy, recovery of spermatogenesis may take 2 to 3 years or more. Note lang that retroperitoneal lymph node dissection may result in ejaculatory dysfunction leading to infertility. Dahil dyan, sperm banking is an option that could be done before any surgery, chemotherapy, or radiotherapy. In fact, Sperm banking is recommended for those wanting to preserve fertility. Kaya huwag panghinaan ng loob mga bro. With modern therapeutic approaches, cure can now be expected in more than 90% of males diagnosed with testis cancer. Napakataas ng chance gumaling. Pero remember, the earlier detection, the better. Huwag mahiyang magpa-check. Seek consult with your friendly urologist now.